in every life when health stops being an idea and becomes personal. A pain that will not go away. A blood test that changes everything. A parent who forgets your name. A child with a fever at midnight. A diagnosis whispered across a desk. In those moments, medicine is no longer something that happens to other people. It is yours. And that is why we are here. Not to frighten you, not to confuse you, but to explain, to guide, to ask the many questions that patients are afraid to ask, and to answer them, hopefully, with science, compassion, and common sense. This evening, we bring medicine back to where it belongs, close to the people. Welcome to CNC3's Ask the Doctor. We're live on Facebook and the CNC3 website on Thursdays, with reruns on Friday at 11 a.m. or Saturday at 11:30 a.m. Don't forget to like our Ask the Doctor page and follow my articles in Friday's Trinidad Guardian, with a new We Health segment on Tuesdays, where your burning questions will be answered. But as usual, let's start with the doctor's capsule. As World Cup fever takes over living rooms, offices, bars and barbershops, viewers may have noticed something strange on the pitch. Some footballers are running around with holes cut into the backs of their socks, not torn by accident, cut deliberately. Now, at first glance, it looks like just a fashion statement, or perhaps one of those football rituals that begins with one superstar and suddenly spreads across the world. But there is a little sports science behind it, apparently. Professional football socks are tight by design. You know, they help to hold these shin guards in place, support the ankle and foot, and perhaps manage sweat and reduce slipping inside a boot. The problem is that some players feel the compression around the calf is too restrictive. During a match, the calf muscles repeatedly contract, expand, and would you believe, change shape with every sprint, turn, jump, and tackle. And during 90 minutes plus, that can create a sensation of pressure, tightness, tingling, or discomfort. So some players started to cut small holes in the calf area of the sock, hoping to release some of the pressure. Does it make them faster? So far, we're not sure about that according to evidence, because at the moment, there is no good scientific proof that cutting holes in socks would improve performance, prevent cramps, or reduce injury. In fact, compression garments, when properly fitted, may help some athletes with recovery and muscle inflammation after intense exertion. So some players will keep doing it because comfort matters, and of course in elite sport, perception can change performance. If a player feels restricted or might be annoyed or distracted, removing that discomfort may make him or her feel freer, more confident and more in control. So even if the stopwatch does not show a measurable improvement, this is where medicine perhaps meets psychology. So bear in mind, athletes are not machines, although it might be argued Haaland certainly moves like one. But they have routines, rituals, habits, and beliefs. They will kiss the World Cup. Some will step onto the pitch with the same foot first. Some will wear lucky boots. Some cut their socks. And the lesson, I suppose, for the rest of us is simple. Not every popular health or performance habit may be backed by strong evidence, but discomfort should not be dismissed either. If clothing, shoes, or equipment causes numbness, tingling, pain, or marks on the skin when you're exercising, it may be too tight or poorly fitted. And for my patients with diabetes, poor circulation, or nerve problems, this matters even more, because tight shoes or socks may cause injury before pain is even felt. So the next time you see a World Cup player with holes in his socks, remember, it may not be magic, science, or fashion. It may simply be a footballer trying to feel comfortable enough to perform at his best. The holes in the socks may not help the science, but it may help his mind. And in football, the mind is always part of the match. And hopefully FIFA doesn't interfere too much either. Further afield, the school holidays have arrived, and for children, this is one of the happiest times of the year. No early morning rush, no school shoes to polish, no lunch kits to pack. Cousins start appearing, grandparents become emergency babysitters, and man, that house fills with laughter, noise, wet towels, arguments, snacks, crumbs, and children who somehow become hungry every 20 minutes. But while the holidays bring freedom, they also bring risk. And during the school term, children live inside a structure. Teachers are watching, bells ring, timetables guide the day, gates, classrooms, and routines create a protective fence. But when school closes, that fence disappears. Children move between homes, beaches, rivers, pools, camps, malls, backyards, playgrounds, and cars. So supervision must be shared. Sometimes, though, it can be assumed, and that is where danger often enters, not through neglect, but through one small misunderstanding. So remember, a minute is enough. A minute is enough for a toddler to reach a bucket of water. A minute is enough for a child to slip into the pool. A minute is enough for a teenager to dive into a river whose depth he misjudged. Enough for a pot handle to be pulled from a stove. Enough for tablets to be swallowed. Enough for a gate to be opened. Enough for a car to reverse. We see that all the time in emergency rooms. So this evening, as families enjoy the holidays, we want to remind parents, grandparents, and guardians on Ask the Doctor, safety is not about fear, it is about attention. Now, water is one of the biggest risks because in Trinidad and Tobago, childhood is tied to water. Whether we visit beaches, rivers, pools, and family homes, we allow children to run freely, and drowning is often silent. A child may not splash dramatically or shout for help. Sometimes there is only disappearance of that child below the water. And the safest adult is not the one chatting from a distance. It is the one assigned to watch. The phone is away, the eyes are open, and the adult is close enough to act. So appoint a water watcher at gatherings. Say clearly you are watching the children for the next half an hour. Then change shifts. Vague supervision is no supervision at all. Heat is another danger. Children run until their faces shine. And of course, they always insist that they're great. Babies and young children overheat faster than adults. Give water before they ask. Plan outdoor play for cooler hours. Use shade, hats, sunscreen, and rest breaks. Dizziness, headache, nausea, cramps, confusion, or fainting could be signs of heat exhaustion, should never be ignored. And please, never leave a child in a parked vehicle. Not briefly, not with the window cracked, not because you're just running inside for a few minutes. Cars heat very quickly. A sleeping baby can be forgotten when routines change. Put your phone, your shoes, or handbag in the back seat. That's going to create a habit. That's going to force you to look at your child there before you lock. And road safety matters too. Seat belts are not optional. Car seats are not decorations. A child standing between the front seats is not cute, It's dangerous. Drivers reversing out of yards must know where every child is before the vehicle moves. Inside the home, medicines, cleaning fluids, kerosene, bleach, and all those toxins like pesticides should be locked away. Your tablets can look like sweets. Pot handles should always be turned inward, and hot drinks should be kept away from table edges. Burns can happen in a second and scar for life. Food safety is also part of holiday health. Fried rice left too long on a table, chicken warmed and rewarmed, picnic food sitting in the heat, and unwashed hands can lead to vomiting, diarrhea, and dehydration. Keep hot food hot and cold food cold. And I think a useful dictum is, when in doubt, throw it out. that hospital bill will cost far more than some spoiled pillow. Not every danger is physical. More free time often means more screen time nowadays. You're gaming and messaging. So we're not saying to spy on children, but at the same time, do not abandon them online. Know the apps, set limits, keep devices out of bedrooms late at night. Teach children that secrets with adults online are warning signs. So you want to get them into a sort of a rhythm. Children need sleep, meals, play, reading, chores, prayer, sport. They need a little boredom and conversation. And don't think about boredom as just having them feeling lonely or abusing them. Boredom sometimes is where imagination grows. Before sending a child to a camp, an outing, or another home, ask direct questions. Who will be there? Who is supervising? Is there water nearby? Who drives? What happens in an emergency? And I'll tell you this, politeness has never protected a child as well as a clear question. And give children rules that they can repeat. We spoke about not going near water without an adult. Do not leave with anyone unless your parent or guardian says so. Do not take tablets, sweets, or drinks from strangers. Do not keep secrets about touching. Do not cross the road without looking both ways. Do not hide if you are lost. So the goal is not to frighten children, it's to equip them in the new millennium. Parents, we know you're tired. Grandparents, doubly so. Teachers are tired. Children, of course, somehow are never tired when we need them to be. None of us will get everything right. You can still get accidents in loving homes. But many tragedies we see are not random. They're preventable moments that needed one barrier, one locked cupboard, one question, one life jacket, one extra strap on that car seat, and one adult paying attention. So let the children play, let them swim, run, laugh, climb and explore, read, build forts, ask for snacks, and turn the house upside down. Just do not confuse freedom with the absence of care. Childhood is precious because it is brief. Safety is how we give children the chance to enjoy it. It's time for a short break, and when we return, the Kiddies Capsule is coming up next.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
With the cold and flu lurking around every corner, keeping your immune system strong allows you to live the life that you want every day. Discover BioStrath Immune Health. BioStrath Immune Health is a unique plasmalized yeast product that enhances the absorption of essential micronutrients, ensuring that your body stays resilient. And now enriched with zinc, it is your go-to support for immunity. Staying vibrant and healthy just became a whole lot easier. BioStrath Immune Health. Get what you need naturally.
Get a loan at Bremont. The process is simple. Fast and efficient approvals. Receive funds within 24 hours once approved. And no penalty for early repayment. Located at 4 Gala Street, Woodbrook. Remember, we like to lend.
Welcome to Holiday Inn Express and Suites.
Do enjoy, Stacey. You want some coffee?
Can I have a bit?
Perfect then.
That's exactly what we need.
Hey, the pool is this sweet.
Whatever you're here for, we're here for you. Stay smart at the Holiday Inn Express and Suites.
back to CNC3's Ask the Doctor. Those questions may sound small, but inside them is the beginning of science. Let's explain the body in a way children can understand, parents can enjoy, and families can remember. The Kiddies Capsule reminds us that healthy children begin with curious minds. Let's have a look at this evening's fan favorite segment.
Hello, my name is Vincent, and today I want to talk about how emotional intelligence helps keep us healthy. Emotional intelligence means understanding your own feelings and the feelings of others. When you recognize how you feel, you can talk about your emotions. Sharing how you feel with someone you truly trust allows them to support you and can help you solve problems before they become bigger. People with good emotional intelligence are often calmer, make better choices, solve problems more easily, and build healthier friendships. This can reduce stress and help keep the heart, brain, and body healthy. Remember, it's okay to talk about how you feel. What matters is expressing feelings respectfully and responding with kindness, empathy, and respect when others share their feelings with you. That was your Kiddies Capsule. Have a great night.
Good evening, everyone. My name is Bella Pridam from Lando Hindi Primary School. To all the SCA students, congratulations on passing this important milestone. Whether you pass for your first choice or not, just remember, one result does not define your future. Just surround yourself with positive people, talk to people you trust if you're feeling overwhelmed, and be kind to yourself and others. Bullying is never okay. And remember, a healthy mind builds a bright future. So keep smiling, keep growing, and your best in the future is yet to come. This was your Kiddies Capsule. Bye!
Good evening, everyone. Pollution is more than just dirty streets or smoky skies. It's present within the air we breathe, the water we drink, affecting our lungs, heart, and overall health. Remember, pollution is persistent, pervasive, pernicious, and it kills. The good news? Every small action counts. Reduce waste, recycle, and keep your surroundings clean. Protect the planet, protect your health, because a cleaner environment means a healthier future for us all. My name is Anastasia Lachmidial from Saraswati Girls Hindu College, and this is your Kiddies Capsule.
Good evening. Think the heat is just making you sweat? Think again. Severe heat or continuous heat can cause headaches, dizziness, muscle cramps, and even cause damage to your heart, kidneys, and lungs. And in severe cases, it can even lead to heat stroke, a medical emergency. So beat the heat by drinking lots of water, wearing light clothing, staying in the shade, and avoiding strenuous activity during the hottest hours. Stay cool, stay hydrated, and stay healthy, because the heat isn't just going to make you feel uncomfortable, it can make you sick. I'm Abigail Pridam of Saraswati Girls Hindu College, and this was your Kiddies Capsule. Bye!
We say a special thank you to all concerned for that treasure trove of information. Feel free to send in videos of school-aged children discussing health-related themes to Uncle Rajiv at 800-CNC3. It's time for a short break, and when we return, the Medical Minds segment awaits.
Heart disease is the #1 cause of death in Trinidad and Tobago, driven by two silent threats, diabetes and high cholesterol. But now there's a powerful ally, introducing Berberine Plus by Asia Nutrition, clinically proven to stabilize blood sugar and keep cholesterol levels in check. With 99.9% pure extract, you get superior absorption and real results. Available now at Pennywise and leading pharmacies nationwide. Berberine Plus. Your heart deserves better.
Come to Jimmy Boo Super Serious July Sale for seriously super-sized savings. Get the year's biggest savings yet on textile, curtains, home goods, and much more. Seriously, shop the Super Serious July Sale today at Jimmy Boo in Barataria and Port of Spain.
Step into ABC Doors and Windows, where quality meets variety. Discover premium wooden, steel panel, fiberglass, and steel security doors alongside aluminum, UPVC, and steel windows designed for strength and durability. At ABC, we're always a better choice, delivering products built to last and service you can rely on. Visit our showroom at 1 Chanka Trace, El Socorro South, or call 638-7184 to make your dream home a reality.
Slam 100.5 FM and Amplio are bringing football fans together for the ultimate Friday football rhyme. Get ready for Amplio Front Row Fridays. Your front row seat to every match, every moment, every Friday. From June 26th to July 19th, the Slam Crew hits different sports bar and football hotspots across Trinidad with live broadcasts, football trivia, crowd challenges, predictions, giveaways, DJs, vibes, and level football energy. Catch the Slam announcers broadcasting live from 7 to 9 p.m. every Friday. Check out the Amplia promo girls and giveaways on location, interactive games, fan moments, and non-stop excitement. Front Row Fridays, powered by Amplia and Slam 100.5 FM, progressive and unstoppable.
Welcome to your #1 show for news, views, and interviews of all things medical. This evening's guest deals with one of the most important rules in medicine. If there is blood where blood should not be, do not ignore it. If passing urine becomes difficult, do not suffer in silence. And if men's health becomes embarrassing, remember that embarrassment has never saved a life. Urology is a specialty that many patients avoid until fear forces them through the door. But it is also one of the specialties where early action can change everything. From kidney stones to benign prostate disease, from urinary infections to cancer, from bladder symptoms to erectile dysfunction. This evening we bring an often private conversation into the open. Joining us is no stranger on the medical minds, urologist and University of the West Indies lecturer, Dr. Satyendra Prasad.
Hi, good morning. One of the more common things that we as urologists are asked to see is benign prostatic hyperplasia, or BPH. And all that means it's a benign enlargement of the prostate. So it's just simply an enlarged prostate gland that's not cancerous. And signs and symptoms of BPH include difficulty starting the flow, weak flow, intermittent flow, so the flow tends to stop and start. When the man finishes passing urine, he feels as though he's not emptied everything, so incomplete emptying. And then when he's finished, he has to run back to the bathroom again, quite quickly. That's urgency. And then frequency, which means he goes more often than every 2 hours. And he can also have nocturia, which means he's waking up at night to pass urine. If he has these symptoms, or if you have these symptoms, you should actually see a urologist. Your urologist will examine you, and he might get some blood tests, urine tests, as well as an ultrasound scan. The important urine test to get done is a PSA, which is a prostate-specific antigen that helps us to make sure that this thing is really benign and it's not prostate cancer. The ultrasound helps us to see the size of the gland to be able to tell you what is the best treatment for your condition. And occasionally we might need to do a cystoscopy. We place a small camera into the penis to actually take a look at the prostate to see how it's configured. Now, depending on your symptoms and your prostate size, your urologist might make either a medical or surgical suggestion. And we typically start with medical management. We have a number of great medications locally. Medications like tamsulosin or silodosin, which can actually relax the prostate and allow you to pass urine much easier. And there are medications like dutasteride that shrinks the prostate. Now, dutasteride shrinks your prostate about 25% over 6 months. So it's important to know that you should be on these medications for 6 months before you make a pronouncement that it's not working. If the man has concomitant erectile dysfunction, we might start them on something like low-dose tadalafil, which is fantastic in that it helps the flow as well as the erections. And if medical management doesn't work or the prostate symptoms are severe enough or the man simply does not want to take medication, there are a number of fantastic surgical options locally. We have the old-fashioned TURP, which still works very well, where you scrape the prostate layer by layer. There's green light laser, where we burn away prostate tissue to create a channel. Think of it as a donut where the hole is now shrunk, and you're trying to make that hole wider to get a bigger channel to pass urine through. We now have resumed steam treatment, where steam is injected into the prostate. This takes about 5 minutes. It's a day case. Steam is injected into the prostate, and the prostate tissue dies off slowly, creating a bigger channel. This is a fantastic option for men who want to preserve sexual function and for men who are not fit enough to have general anesthesia. We have HOLEP, where you actually cut out the prostate from the inside, and all of these options do not involve cutting the skin in any way. These are all done internally. And we, of course, have, mostly in the public system, we have open prostatectomy. We make a cut and we remove the inside of the prostate, leaving a nice white channel. All of these are fantastic surgical options that you can discuss with your urologist. Hope this helps.
And we say a special thank you to Dr. Sati Prasad. I think that his pearls of wisdom reflect not just an excellent clinician, but a thoughtful teacher. It's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. The giveaway segment with the compliments of Great Health Works is coming up next.
Dust, allergies, congestion, dry air, your nose deals with it all. Now there's one solution designed to do more. NeilMed Nasa Mist All-in-One combines 3 specially designed nozzles in one convenient can. Spray or irrigate to cleanse, moisturize, and soothe nasal passages with sterile, preservative-free, pH-balanced saline. Relief from allergies, congestion, sinus pressure, and everyday nasal irritation. NeilMed Nasa Mist All-in-One. One spray. 3 ways to breathe better. Available at pharmacies nationwide.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
It's giveaway time with the compliments of Great Health Works. A special hello to Joseph Sendell and the rest of his team. So the numbers are on the screen. We'd love to hear from you. And as a reminder, when you're patched into the studio, listen on the telephone rather than the TV set, because there is a delay that creates confusion. So as we delve into the medical dictionary once more, our question this evening: when the eyes turn yellow, the liver may be trying to speak. It sounds almost poetic, doesn't it? What is the medical term for this warning sign? The yellowing of the eyes, the whites of the eyes, the mucous membranes and skin. And I'd like you two to spell that word. As our first caller hails from San Juan, good evening and welcome to Ask the Doctor. Hello? Hello? You're on the air. Good evening. It sounds like that caller got cold feet. Or did they? Hello?
Yeah, hi, good evening.
Welcome to Ask the Doctor, sir. You're on the air. What's our answer this evening? The eyes turn yellow, the liver is trying to speak, perhaps issues with the gallbladder, even the pancreas. The levels of bilirubin start rising. What's that term? And we want you to spell it as well.
Is it jaundice?
can you spell it for us? So it's not just a matter of saying the word. We want the right spelling. Because in local parlance is often mispronounced, so we just thought that we wanted you to get the right spelling.
Hello?
Hello, we're hearing you. Go ahead.
Hi, is it Jaundice?
Hello, yes, and we want you to spell the right answer. So if you could. So,
is it
go ahead.
Genders?
So unfortunately, that is not the spelling, because there are local terms used sometimes, and I know that even modes of treatment. So we want the right spelling, and we can give you another chance if you wish, the right spelling to that yellowing of the skin, the eyes, and mucous membranes. It sounds like
Hi, good evening.
Caller. Good evening. Our caller from Arima, I understand. Hello.
Yes, hi.
Yes, ma'am.
The answer is jaundice, and the spelling is Jaundice.
Jaundice, that is the correct answer, and indeed the right spelling. Well done. So
Thank
it's
you.
a reminder as well, too, that if you see it, it's due to a rise in one of the pigments, the bile pigments, called bilirubin, which is produced when the liver breaks down red blood cells. If you have very high levels, it could sometimes indicate trouble with the liver, gallbladder, pancreas. The doctor would want to scan the abdomen, do various blood tests. It may be normal in certain newborn infants. They're sometimes put under sunlight or special forms of light therapy in the newborn ICU. So thank you very much. So jaundice, and we wanted the right spelling because of the fact that sometimes there may be some confusion locally. So stay on the line. We want to take some of your personal information off the air, and well done, ma'am. Jaundice, so a common term. I knew that would be something to add to your local terms. It's time for a short break, and when we return, it's the open forum with your questions and hopefully answers.
Hey, man. Where are you? Okay. He said 5 minutes. Anyone want dessert? Maybe he's stuck at the office? Surprise! Not yet, Carl.
Bro, I'm literally at the altar right now.
Relax. I'm almost there.
We're like the friend who isn't always late.
You have the rings.
CG United. Good like that.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
Period nights don't have to look like this. Move less, wake up to change. So change for a real night's sleep with Always Overnight. Its 3 times protection system absorbs, locks the fluid, and keeps it away from your skin. For protected nights without leaks. Always.
From Trinidad and Tobago to Curacao, experience one of the biggest football weekends in the island's history. But beyond the excitement on the pitch, explore the people, the culture, and the atmosphere that makes Curacao so unique. This Sunday at 6:25 p.m. and catch the repeat on Wednesday at 5:30 p.m. Only on CNC3.
Welcome back to the open forum of CNC3's Ask the Doctor. It's your time. We'd love to hear from you. And the numbers are once more on the screen as a gentle reminder when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. I understand the phone line's already burning up. Hello, good evening, and welcome to our program. Hello? Oh, it sounds like we lost that caller. And just as an addendum to that question when we were talking about jaundice, so basic blood investigations. And you know what's interesting about liver disease now, and I've mentioned on this program before, that fatty changes to the liver. There are some new terms used, like metabolic associated steatotic liver disease, big word, referring to that fatty liver that might be detected incidentally on an ultrasound based on blood tests. It seems to be virtually ubiquitous in people with diabetes, obesity, or high cholesterol. And that is the liver letting out a silent scream. It's a warning sign, because fatty changes, not alcohol-induced, those are becoming leading causes for cirrhosis of the liver, end-stage liver disease, even liver cancer. So it's a reminder, have a chat with your doctor about this silent pandemic. As our first caller this evening hails from Arima. Hello, welcome to the Open Forum.
Good evening, Doc.
Welcome, ma'am. Good evening.
Good evening. Hello?
Hello, we're hearing you loud and clear. It's a pleasure to have you.
I wanted to ask a question or two.
Certainly, ma'am.
Firstly, I would like to know, why is it the pressure is so high when you awake in the morning?
Yes, ma'am.
And during the day, it goes low. So it is high 140 something, 151, and over about 89 when I get up in mornings. And after moving around, when I check it around midday, it's going right down to 109 over 60 something. So I am getting very concerned about it. You can tell me what I have to do if I have to see a doctor, you know. And secondly, I think I had called you with respect to my feet. My both feet is feeling all the time as though I am having on like a tight socks or tight shoes. I'm not seeing any swelling, but it's just feeling tight, you know, like if I have the slippers on and it's off, I'm not sure. I have to look to see if I have anything on.
Yes.
So I would like you to give me a little advice on it, what I should do, if I should go see a doctor. I would have loved to see you.
Yes, ma'am.
But I don't know South.
Yes, thank you very much for taking the time to call in. And two fascinating questions when we're discussing problems with hypertension and changes to sensation to your feet. So hypertension, as we know, is a silent killer. It's the single most important preventable cause of premature death. When we're thinking about damage to organs, those may include eyes, brain, heart, kidneys, the blood vessels. And I want to congratulate you for actually monitoring so that you can have an idea if there are spikes or changes to not just your blood pressure, but many of these home monitors may detect rhythm changes or a very fast or slow pulse. So we're trying to get most of the world now to a blood pressure of under 130/80 millimeters of mercury. And that may be changed based on age and risk. And if you're having symptoms, if your pressure may be dropping too low and you are at a risk for falls, sometimes we'd want to be particularly vigilant in the elderly. However, it makes good sense to have a chat with your doctor because there may be spikes in blood pressure in the wee hours of the morning due to changes in some of the hormones or chemicals. And perhaps 3 to 4 while asleep, you'd expect a dip in your blood pressure while resting. But many patients may wake up and notice that there is a rise in blood pressure. It's superb during the course of the day. It's almost like a young girl at 109, and that top number is called a systolic. Sometimes patients actually have a monitor called a 24-hour blood pressure kit. So during the course of the day, the doctor sends you home and then afterwards is able to create a graph or track your readings during the course of a day. There will be basic blood investigations that would be warranted, ranging from your blood count, kidney, liver. Your blood sugar would be useful to know, cholesterol levels, and based on those symptoms that could be linked with your feet, The doctor will then decide if for most hours in the day or the average of your blood pressure readings for 24 during the course of an entire day would be over 130/80. Lifestyle changes initially, low salt, foods like fruits, vegetables, nuts, peas and beans, low fat would all be part of your lifestyle changes, and exercise, of course, 30 to 60 minutes for most days in the week. There's a subtle hidden pandemic too that's lurking because of obesity, and that is obstructive sleep apnea, which was the basis of one of our questions a few weeks ago, in which persons have a wide neck circumference, they snore at night, and may find that they have daytime somnolence or sleepiness, and it's associated with changes to your insulin, your blood pressure. There's an increased risk for rhythm abnormalities in the heart. So some persons may find that they get spikes in blood pressure because of a separate clinical problem called obstructive sleep apnea. In terms of those abnormal sensations to the feet, it's also a call to do some basic blood tests. Are there changes to the nerve endings? Apart from those small nerve fibers like that may cause burning, numbness, lancing, or pins and needles, abnormal sensations require a full examination by your doctor to look for circulatory changes, that is within the arteries and veins, and of course, are the nerve fibers being affected for whatever reason. So I'm not attempting to diagnose, that's one of the disclaimers on the show, but just to nudge our viewers in the right direction. Hello, welcome to Ask the Doctor. Thank you for joining us. Hello. Welcome to our program, you're on the air. Good evening. Hello? Welcome to Ask the Doctor. Yes,
hello,
sir.
Doctor?
Yes, sir.
I was in the urology clinic in Montauk, and I did an ultrasound, and they say that I have a cyst on the right side kidney.
Yes, sir.
So I want to know, they say it's not cancer, so what I could do about it?
Thank you very much for taking the time to call in. That is a very common clinical conundrum, if you wish, to determine what to do with cysts when they're found incidentally. Sometimes patients are sent for a scan of the tummy, and we heard from Dr. Posor that it may be performed as a result of a prostate evaluation to look at the prostate size and see if there are any structural changes. Many patients over the age of 50 may have small cysts incidentally on the surface of the kidneys that cause absolutely no problems. If they're small, if you have no symptoms like pain, infections, or bleeding, most patients within the clinic would just opt to monitor. And I think watchful waiting seems like the appropriate form of treatment for so many of our patients. Do nothing, particularly if the cyst is small, and perhaps a follow-up ultrasound within a year or two may be on the cards. And of course, if symptoms develop, that can always be reevaluated. Sometimes that can be applied to so many issues in urology, including stones that may be found incidentally if they're small, and even enlarged prostates. There are many men will have absolutely no symptoms of prostate enlargement, and it's just monitored along with a blood test called a PSA and sometimes serial ultrasounds. Of course, if the cyst is enlarged and symptomatic, sometimes you may want to consider whether or not it should be drained or whether there's a need for surgical intervention. But of course, there is always a risk that fluid reaccumulation occurs. As we head to East Trinidad, Kumuto is on the line. Thank you for waiting and good evening.
Kumuto,
welcome. Hello?
Hello?
Thank you for being part of our family on Ask the Doctor. Welcome, sir.
I get line. I'm calling from Kumoto, and I have a problem, and so many doctors they don't know what causing the pain.
We will try
in my chest.
Sir. Yes.
You know, like on the left side underneath your heart. Some say it's anxiety, some say it's panic attack, but they say it's worse than a heart attack. And the amount of medication are on right now, and I need some help. And the angiogram, all the tests I do, everything coming back to normal. So, I say I'm going to call your program because every Thursday is assessment.
Yes.
And that's advice what to do.
Thank you so much for taking the time to call in, and that's a fascinating question. And once more, we certainly appreciate your support of Ask the Doctor. Now, chest pain is sometimes difficult to quantify, and it's even a more arduous task for the doctor to determine the cause. It sounds like you've been sent for a battery of investigations. For the sake of our viewers, sometimes pain to the chest on the left side, you'd be sent for tests ranging from blood investigations to determine if you're having a heart attack at the level of the emergency room, to an ECG, electrocardiogram, that looks at the electrical activity of the heart, a scan on the heart, which is similar to an ultrasound, can actually look at the pumping action, the muscle, if there are changes to the walls and chambers. And then subsequently, a more invasive test is the angiogram, which our friend mentioned that involves injection of a dye to determine whether there are blocked arteries. There is a subset of people who continue to have symptoms. Now, all persons with chest pain will not have a cardiac cause. It will not be due to heart disease. Sometimes it may be due to problems with the lungs. It could be due to acid reflux. It could be muscular on the left side of the chest, particularly if it's tender on some parts when you're pressing. And of course, anxiety is always one of the diagnoses of exclusion. So after you've excluded all of the aforementioned reasons, then you may want to consider that anxiety is possible. Now, what's interesting, and they used to have an old term for persons called Syndrome X. It was difficult to quantify and to actually determine a reason for chest pain. It's thought that perhaps there may be spasm to those blood vessels. Those persons have very classic symptoms, chest pain that may be central, associated with sweating, nausea, may radiate to the jaw, and it mimics, that sort of pain mimics heart disease, and medications to relax the blood vessels may actually help. So it's a matter to controlling symptoms. There may be some modes of dealing with this anxiety if that is indeed the reason, ranging from listening to music. If you're deemed safe to exercise, do so. The great outdoors may sometimes soothe the mind. Meditation, yoga. So there are drugs that may help symptoms, and if there were no blockages to the arteries and you've had a battery of tests which were normal, the diagnosis may well be within that realm. However, bear at the back of your mind that it could be due to muscular reasons, sometimes stomach causes, or there may be an inflamed gullet. We have so many patients who may have lung issues, and it could be due to perhaps an inflammation to the lining of the lung that causes chest pain. I'm assuming that those tests would have been done within the eastern part of the region, and we wish you all the best in getting an answer. I can hear the concern in your voice, but dealing with anxiety may range from non-pharmacological measures to sometimes drug treatment. So have a chat with your doctor, and that may occur within the cardiology clinic or the heart clinic to see if anxiety is indeed the reason. There may be forms of treatment and clinics available to assist you. Our next caller hails from the Sister Isle. Good evening and welcome to our program.
Yes, hello, good night.
It's an honor to have you on our show. Good evening.
I'm calling to find out what causes a bladder in the stool after it's the tooth.
Yes, ma'am. And thank you very much for taking the time to call in. It's always a delight to hear our many viewers that are always locked in, I understand, to this program on a Thursday. And blood in the stool is sometimes tricky to determine the reason, because In persons who may have hard stools, if you're forcing at times and have a history of constipation, it may be an innocuous reason such as piles or hemorrhoids. So those are swollen veins in the rectum that may sometimes have bleeding. If it's bright red blood and you notice when wiping with the toilet tissue that it's present, it could be something relatively harmless, and your doctor would still want to not just examine but also do some investigations. However, the situation becomes rather dicey. If you have a drop in blood count, if you're having abdominal pain, perhaps a family history of colon cancer, if you're over the age of 45, you may want to consider doing a colonoscopy. That involves the use of a camera to examine the large bowel to determine whether or not there are polyps or lesions that could be accounting for that bleeding. In persons who are older, there may be sacs in the lining of the large intestine, and that term is diverticulae, and there sometimes may be infection, inflammation, and occasionally bleeding. If you're on medications, if you have a briskly bleeding ulcer in the stomach, this may all account for blood in the stools. So the possibilities are myriad. It's all a matter to have a chat with your doctor to determine certain investigations, including a colonoscopy. Wow, parting is always such sweet sorrow. And a closing quote is from the renowned poet who was born in the US and then afterwards moved to England, T.S. Eliot. And what an excellent way to end the program. Only those who will risk going too far can possibly find out how far one can go. He reminds us that we never discover our full potential by staying safe. You can't always bat in your crease. In health, in learning, in family, and in life, progress often begins when we are brave enough to go a little further than we thought we could. Thank you for trusting me to walk beside you each week in your homes and in your hearts. To my team behind the lens, to the bubbly Neil and baby Daniel, and to you, our viewers, stay strong, stay curious, and never stop choosing kindness. Rest, reflect, love deeply. God bless, and we'll see you next week on Ask the Doctor.